Welcome to the Natural Treatment of Arthritis Institute's presentation of the 10 steps to preventing, managing and reducing the pain and limitation of arthritis. I'm Dr. Marcus Chakos, chiropractor and wellness expert, author of the life-changing book The Arthritis Solution and founder of the Natural Treatment of Arthritis Institute. In this presentation, I'm going to provide what I believe is going to be a turning point in your health and in fact your life. Because many people believe, certainly they believe that you can prevent arthritis if you take care of yourself, and we're going to show you that's exactly true. But many people also believe that once you have arthritis that it's something that you have to live with, something that you endure for the rest of your life. We're going to show you that there are things that you can do, not just to prevent arthritis, but that you can actually manage the condition and reduce the pain and the limitation of arthritis, creating a significant improvement, a dramatic improvement and enhancement of your quality of life. So let's get straight into this and begin by understanding what exactly is arthritis. Well, the word arthritis comes from the Greek arthro meaning joint and itis meaning inflammation. It's a joint disorder that involves inflammation of one or more of the joints. And in fact, it's a combination of a multitude of varying conditions that involve inflammation, joint pain, restriction, and in fact can involve and incorporate skin conditions and organ dysfunction as well. But let's not get too far ahead of ourselves. Let's just think for the moment about the general understanding of what arthritis is. And we know from most people's perspective that arthritis it could be in the hands or the back or the feet where the joints are stiff and sore and painful, and the inflammation that goes with that pain causes the pain, causes the limitation, and creates the dysfunction that is known as arthritis. Now, there are of course a number of different forms of arthritis and a number of different ways in which arthritis and the inflammation of arthritis can be triggered. The most common of these is age. When we think of arthritis, we invariably think of the older person, the person who's 40, 50, 60 years plus, and definitely as you go beyond that, most people have some level and extent of arthritis, and that is because the body does deteriorate with age, and with age the many forms of arthritis form. And while we do see arthritis as an aging process, arthritis can occur at different times in life, not just with the aged population. Of course, there is juvenile rheumatoid arthritis, where it's a form of arthritis attacking the body, an autoimmune process that happens in younger children as well. And then you have different arthritis formations in different age groups as well. So while age is a factor, it's not the only factor, and it is not the primary cause of arthritis. Because as a chiropractor and a specialist in arthritis, I have seen hundreds, thousands of clients, many of whom even at age 79, I have an x-ray of a 79-year-old with no arthritis in her body at all. So yes, age is a risk factor for arthritis. It is but one of the risk factors, and there are more we need to look at and discuss. Joint injury is another factor. So for example, if you have what is called a traumatic injury, you might have a major car accident, a bike accident, a fall, or a traumatic impact to a tissue. That damage, if unaddressed, untreated, or ineffectively managed, can be damaged and become dysfunctional over time. That joint injury, when it occurs, allows the tissue to become more prone to arthritis and degeneration as a result. So inflammation caused by trauma or joint injury can lead to a degenerative process. Extra weight that you carry on your body places stress on joints. So obesity and being overweight can wear joints at a more accelerated and rapid rate. Furthermore, when you have an overweight body size or body shape, there's invariably an inflammatory process going on within your body as well, and that inflammation, coupled with the extra load on the joints and possibly the aging process and the other factors associated with arthritis, can accelerate the degenerative process and the inflammatory process and lead to arthritic change. Certainly when you think of an elderly person with arthritis, if they're carrying additional weight, it puts enormous pressure on their knees, on their hips, on their spine, and that can aggravate the presence of arthritis, not just be a triggering factor for it. So obviously taking care of yourself is a really important process in managing the arthritic process, and we'll talk a lot about that throughout this training program. Genetics also play a role in arthritis. In fact, there are many arthritis or forms of arthritis that are invariably called genetic. For example, some forms of rheumatoid arthritis have what's called an autoimmune process, and there is a genetic inheritance factor. Now, that's not to say that arthritis is genetic. It just means if there's a genetic predisposition, there's the possibility or an increased possibility or likelihood of arthritis playing out in that person's life. I do want to explain something about this because genetic predisposition is that's a complicated term, but I want to simplify it for you. So genetic means something carried in the genes. Predisposition means an increased likelihood too. So if a person with, say for example, rheumatoid arthritis has children, then there is a genetic predisposition in those children to also have a form of arthritis because it is carried through the genetics of that person. Now, what's really powerful and exciting about this is a predisposition isn't a requirement that the gene becomes activated. You need environmental factors to trigger that gene. So a person with arthritis who has children with arthritis, if those children live the same type of lifestyle, eating the foods that trigger rheumatoid arthritis, having the stress levels that trigger rheumatoid arthritis, put themselves in contact with some of the organisms that are infective that may lead to, contribute to, or produce the arthritis, then there is an increased likelihood of the arthritis forming and being genetically carried down the line. Of course, if they recognize that some of the choices that their forebearers have experienced are the food choices, the exercise choices, the emotional and environmental choices, and they move away from those, then the genetic factors aren't such an important element. So you can control these lifestyle elements and even these genetic elements, as we can see, that can be leading to the inflammation and the causation of arthritis. Certainly, we also need to look at arthritis in the terms of the gender. Women are more likely to get many of the different kinds of arthritis, although diffuse idiopathic skeletal hyperostosis, which is also known as DISH, is more common in males, for example. So rheumatoid arthritis is more common in females, osteoarthritis may be more common in males as well. So your gender will determine the likelihood of certain forms of arthritis. So what is important to recognize that there are all of these factors that not only contribute to the inflammation and the degeneration of your body, but the likelihood of arthritis forming. So when you know this, you can make higher and better choices. Of course, for many people, they say, well, do I have arthritis? How do I even know if I've got arthritis? What exactly do people with arthritis experience? And you may have come to this site knowing that you have arthritis, perhaps osteoarthritis, rheumatoid arthritis, or one of the other forms of arthritis. But you may have also come here saying, well, I'm feeling sore, my body is aching, I don't move the way I used to, and I need to know whether or not it is arthritis that I have. So we're going to share with you here the symptoms, firstly to make certain that you do understand what the symptoms of arthritis are if you have it, and equally if you don't, what it could be that these symptoms are for you to confirm your position of arthritis. But I'd always suggest that seeing a healthcare practitioner such as a wellness practitioner, a chiropractor, and even your general practitioner will help you to get a clearer, more unequivocal diagnosis and therefore clarity of the picture. So, the symptoms of arthritis, what exactly are they? It varies according to the different type of arthritis you have, but generally speaking, the majority of symptoms are felt in the joints. And these include stiffness, where there's just my neck or my shoulder or my joints, it's just stiff, they don't move, they feel rigid, and it really is uncomfortable. Because of that stiffness, you get a decreased range of motion. You don't have the same movement or flexibility, the same ability to stretch your tissue to its full end range of motion, and that is obviously an uncomfortable experience. There's also pain. You can have not just joint pain, but the pains around the joints where the muscles are having to work harder and the ligaments being inflamed mean that arthritis can create pain anywhere in your body, from your hands to your neck and lower back even, all the way to your knees and your feet. You can have pain that is a consequence of the inflammation and degenerative process of arthritis. Some forms of arthritis in particular produce redness or swelling and heat over that area. So the tissue can puff up and it can be quite warm to touch, swollen with the inflammation of the arthritic process, and the redness is again an indication that there is an inflammatory process going on. This would be an acute form of the arthritis, and you'll see this localized above a joint, such as your hands or your feet, your knees, even over areas of the spine. All of these symptoms demonstrate not just arthritis, but they could be other sports injuries or strains or overwork syndromes from work, etc. But on the whole, if you've got these pictures and it's been persisting for a longer period of time, weeks, perhaps even months, you may have the likelihood of some degenerative process, particularly if you know that you've had a trauma to that area, or that if you are aging in years past 40 or 50 years of age and you're constantly stiff for weeks and months at a time, that your bones don't move the way they used to, that they're sore, or perhaps there is some redness and swelling, then this is a really strong indicator of the presence of arthritic change and degeneration. Now, there are many different forms of arthritis, and that's why they can present very differently. Now, we're going to talk about a couple of the forms that are most common here, and obviously I could spend several hours detailing the number of different forms, but because we can't necessarily cover all of that within the scope of a training program like this, I want to cover the key forms of arthritis for you. The first is osteoarthritis, and this is by far the most common form. Osteoarthritis affects more than 4 million Australians, making it the most common type of arthritis, and this is and can be localized to any joint in the body, but again it's generally thought of as an overuse form of arthritis, a wear and tear. And again, this is the most common form of the stiffness and the soreness, the inflammation, the aches and the pains. And it doesn't matter what joint, it can occur in any of them. And as a chiropractor and wellness specialist, I have seen it in all joints throughout the body. The knees, the hips, the hands, the neck, the lumbar spine, the lower back area of your spine is a highly common place for localizing of the arthritis. So osteoarthritis, wear and tear, degeneration, most common as you age. There's also rheumatoid arthritis, and again this would be not quite as common as certainly as osteoarthritis, but it is more common than some of the other lesser known forms of arthritis, like as I said, that diffuse idiopathic skeletal hyperostosis, which is a big fancy crazy name, but much less common than say rheumatoid arthritis. And we do see this a lot, again not just in the elderly, but certainly women as they approach 40 years of age can start experiencing symptoms of this autoimmune disease, where it's not just the pain and the soreness the client experiences, the person has with this condition. They also have huge inflammation and start getting the distortion of the bones as the body's autoimmune process attacks it. So you get the distortion, the joint starts to misshape, your hands start to look a little bit deformed in respect to the actual articulation or joint itself. And there's an image there, obviously you can see that the body starts to change, and most people know that they are starting to get nodules on their hands or on the feet as well. And when they look at these, they go, gee, that looks a bit odd. And if it's sore and inflamed, and there's oftentimes redness with rheumatoid arthritis, and they go, okay, I better get this checked out. And you'll get x-rays to confirm this, but certainly blood tests with a chemical that they test in blood called rheumatoid factor is another indication that rheumatoid arthritis, which is attacking in the body's own immune system, attacking the bone and the synovium, which is a covering of the bone, and eating that away and creating the dysfunction and distortion. So it's certainly a common occurrence, and we certainly need to understand when this is occurring, because the earlier you get in to manage the inflammation with this, the greater the impact you can have. So don't delay if you suspect that you may have one of these conditions. Another, again, less common, but certainly a condition that we are seeing, in fact, more and more of, is gout. And this is an inflammatory condition that comes on with very sudden, severe attacks of pain, swelling, and tenderness. Most commonly localized to the big toe or the hallux, and it doesn't mean it has to be there, but that's the most common location, and that's when you find it so difficult to step on your foot because it's really painfully tender, it's swollen, it's red, and it's inflamed. And what happens here with gout is there's a uric acid, which is a chemical in the body that starts to crystallize, and it damages the joint and the articulations, and it starts to actually even give a grinding sensation down there. If you've got pain, particularly in the feet, with a big red swollen area right at the the knuckle of the big toe, then you can consider that this may be a gouty inflammatory process that is taking place. And again, blood testing and x-rays can reveal some information to help understand what is taking place here. The last of the ones we're going to discuss here within this is ankylosing spondylitis. Now, ankylosing spondylitis, or also called ANK-SPOND, is a fusion. It's an inflammatory condition, but it leads to fusion of the ligaments that course down the spine that protect and stabilize the spine. And ultimately, it leads to those ligaments becoming a form of bone, creating limitation of not just mobility, but complete rigidity and fusion, and it really locks the spine into place. And this actually occurs at a younger age, so you can start producing this as a 30-year-old, 20-year-old. Oftentimes see this in males, and I have a number of clients with this, and it just continues to perpetuate. So unless you are aware of this, you're a 20, 30-year-old man with really stiff and sore back, and you don't know why you're so sore. It doesn't feel, the soreness you have isn't warranted based on all of the other experiences in life, but then you go and get these x-rays and you can start to see the ligament shaping into more of a bony sensation, and that's why we see our practitioners, to get the clear picture. And this then gives us the opportunity to make an accurate diagnosis, and we know what we can do with these conditions moving forward to absolutely ensure that you maintain your mobility, your function, and prevent deterioration of that condition. But again, there is a multitude of the different forms of arthritis, and these ones are to demonstrate and help you to understand that there are things that can be done, that once you have a diagnosis, it isn't the end of the road. So it's important to know, firstly, that you can prevent arthritis, and we'll talk about the steps within this that both prevent and also enhance arthritis if you have it. And what's really equally important is to know that when you take action with this information, it starts you on a journey of transformation. So let's look at the 10 different approaches that will enable you to prevent, manage, and reduce the pain and limitation of arthritis. The first one, as we've already alluded to, is attaining and maintaining a healthy weight. If you are carrying extra weight, if you are putting that extra load and weight on your joints, then you can not just increase pain and discomfort and produce inflammation within your body and create all sorts of stress, you can actually enhance the development and progression of arthritis. So obviously the converse is true. If you can drop a couple of kilos, if you can start to get healthier, then you can actually take that weight off not just the weight off your body, but the load off your joints, and that enables you to manage your arthritis better. And again, on a preventative level, if you are maintaining a healthy weight and maintaining a quality lifestyle, you're not switching on the genes that may be there, where there is a predisposition for you to have arthritis. You also, if you do have arthritis, are taking the load off your body, so you're minimizing the impact of arthritis now and into the future. Now, obviously there's a lot that goes into this, and I know people say, look, I've gone on diets, I have endeavored to lose weight. Well, yes, it does take time and effort, and there are ways to do that. And obviously when we work with clients, we coach them through this process. So we do have a done for you program in as part of this website, as part of the training I work with people that absolutely help with a scientific, measurable way of managing healthy weight. So I encourage you to look at that as well. However, for the most part, it's important for you to take responsibility for your health and your weight and put together strategies of achieving a healthy weight for yourself. The next consideration, certainly when managing both our weight and our arthritis, is looking at our diet. We need to make sure our portion control is appropriate, and that is obviously something that helps with our weight, and furthermore is our good food choices. If you're eating the right foods, it goes a long way to enhancing not just your health and well-being, but how your body responds. Another way to reduce your weight and obviously maintain good health and quality of life is regular exercise. You cannot easily lose weight without paying attention to your exercise factors. You cannot easily manage your metabolism without ensuring that you are very active, and that includes both stretching, strengthening, and conditioning your body. So flexibility work with stretching. Strengthening does involve not necessarily going to the gym, but certainly lifting maybe your own body weight and strengthening your body in that way. And your cardiovascular fitness or your conditioning work incorporates not just walking, but perhaps swimming or maybe rowing or other cardiovascular activities that really gets your heart working. The combination of all three of those are essential as an exercise element to reduce your weight in that context. The second of the strategies to prevent, manage, and eliminate the pain of degeneration and arthritis is vitamin D. Getting enough vitamin D. There is so much science out there that supports the correlation between lower levels of vitamin D, the promotion of calcium absorption in the body, and therefore bone health. And bone health is obviously integral to the presence or absence of degenerative change and arthritic progress. And of course, this does mean spending time in the sun, and they do say 15 to 30 minutes of the sun a day gives you enough vitamin D, but so many people aren't absorbing their vitamin D, or are not generating the vitamin D because of the metabolic deficiencies, because of poor overall health. So yes, it's important to get vitamin D from the sun, but you may also need to supplement in this regard. And if you get your vitamin D right, then your calcium absorption and your bone strength is going to be managed. So again, prevention, on a prevention level. How do you prevent arthritis? Take good care of yourself in respect to getting time out in sun. But obviously we're not talking about sunburn here. We're talking about 15-20 minutes of time at an appropriate time under appropriate sun rays each day. In addition to that, if you're not getting that, or if your absorption isn't quite there, then make sure you're supplementing with a vitamin D to prevent it. And as a treatment approach, again, have a look at your calcium absorption through blood testing process. Have a look at what's taking place within your bone structure, and from your health practitioner they can then prescribe vitamin D as a process to really help to create the integrity of your bone. Another strategy for preventing arthritis, preventing the inflammatory process breakdown, is it's not just cigarettes though. Stay away from cigarettes. It's cigarettes, it's chemicals, it's recreational drugs, it's anything that is dramatically pro-inflammatory or toxic for your body. These have been shown to create an enormous amount of inflammation and toxicity within your body, creating the environment where bone damage is more available. So you want to avoid these toxins, these chemicals, these pollutants. And I know sometimes that means making some changes now for your future. I encourage you to do that. It really is a tremendous toxin that is counterproductive to the body's health, and has been shown to actually, with its inflammatory and toxic impact on the body, accelerate the degenerative process. In fact, when you have arthritis, if you're experiencing a treatment program, it slows up the effectiveness of that program having these toxins within the body. So it's time to make that choice if you are already, unfortunately, have one of these habits as a lifestyle process. Here is, in fact, probably one of the biggest impacts. It's managing your stress. I say this, it's such a big impact. You say, well, what has stress got to do with arthritis? Well, there's a hormone produced under stress called cortisol. It is a stress hormone, and when it's metabolized in the body, is actually highly acidic. It's called a pro-inflammatory hormone, which means, and we spoke earlier about the fact that arthritis is an inflammatory condition. If you're producing a large amount of this hormone, and it's producing all this inflammation within your body, what starts to happen is the stress is actually a trigger for the degenerative process. And if there's already degeneration, it magnifies the impact, the erosion happening from all the inflammation present within the body because of the stress response. So the more stressed you are, it's not just your immune system and your general health and well-being that is actually interfered with. It's the body's ability to manage the inflammation. Being diminished actually accelerates the degenerative process. So look for how you can manage your stress, because it becomes a vicious cycle, and you want to actually address it. So here are some stress reducing habits just to touch base on now to help you. That sort of says it all, doesn't it? Ways of reducing stress can start with taking time out for rest and relaxation. It's going to differ from person to person, but you need to be making sure that your life is in balance. You also need to find strategies that are effective in reducing the tension within your body, such as a progressive muscle relaxation technique, or breathing exercises, or journaling to dump all the emotional mental thoughts that you're harboring and are going through your mind over and again. Take time out to listen to soothing and relaxing music. Do these things to enhance your health and quality of life, and your world will be better for it. The fifth strategy I want to talk about that will help you to prevent, manage, and reduce the impact of arthritis in your life is understanding the benefit and place of occupational and physical therapy. Both occupational and physical therapy can improve your quality of life with arthritis because they are specific approaches to enhancing the joint function and mobility, increasing flexibility. And oftentimes these areas of interest allow you to identify where the stresses are, where the inflammatory indications are, and removing them so that you are actually producing positive health and benefit changes. So it's really important to be aware of these. An occupational therapist or a physical therapist, chiropractors, massage therapists, practitioners that understand and can work with you to impact your health and quality of life. I think it's essential that it gets raised and that you look to being supported by a practitioner in that area. Occupational therapists can help with arthritis, reduce strain, and help you with your daily activities. Physical therapists, including chiropractors and massage therapists, can help you to restore your mobility, your function, help you with your fitness, and get you back on track with your quality of life. And I'd include a personal trainer and going to a gym in that section there as well, because they really can give you the skills, tool, and support to make sure your activities improve your health and quality of life. Another tool to help manage with arthritis is the assistive devices, and this is the whole range of tools and equipment that people can use when there is discomfort or there is pain or there is limitation to make everyday activities less of a challenge, easier on the joints, and actually making life more fulfilling. So the common types of assistive devices that we include here are reach extenders, bath stools, raised toilet seats and chair raisers themselves, and in fact canes or even walking sticks. They do help. The seventh strategy is going to be using hot and cold packs. Both heat and cold can help manage the arthritis. Now I'm going to very quickly give a distinction between the two. When it's an inflammatory arthritis, use cold or ice. In a more chronic state where there is no redness, there's no swelling, and you've got more a grinding type sensation, then heat becomes appropriate, and it has an analgesic effect, reducing the pain and discomfort, and actually increases the mobility as well. So understanding the distinction between when to use hot and cold is important, but what the presentation of your case is finding that hot and cold can help when you select the right type of presentation that I've just detailed there. Heat therapy, as I said, is known for relaxing muscles and easing pain and stiffness, having an analgesic effect. And cold therapy decreases pain by numbing tissue and reducing swelling. So, the eighth point, and we're coming toward the end here, so I really appreciate you sticking with me, is taking strategic supplements. And I use the word strategic to emphasize what I'm talking about is specific ones relative to the arthritic presentation and condition, because you can take a nutritional multivitamin or a mineral and they're healthy for you and promoting general well-being of the body. However, what I'm referencing here is specific supplements strategic to managing and preventing the condition of arthritis within your body. So there are a number of supplements you can provide that are drug-free, side effect or symptom-free options for your health and well-being. The most common is glucosamine, and this is a primary building block for joint cartilage, providing the material for the body to repair, grow, and maintain itself. So, there are many quality products out there, and this is a very strategic supplement for people with degeneration and arthritis. In fact, I've had numerous clients saying that, the moment they start feeling stiffness and soreness, and they felt that they were in the age bracket of arthritis and degeneration, and they started taking glucosamine, and the symptoms dissipated. It can be that profound, particularly in those early stages. And equally with people who've had arthritis for a long period of time and have been unaware of what is available to them, them taking glucosamine has enhanced their body's recovery rate, their level of pain and discomfort that is there, and again it helps the management of that condition. Chondroitin, also known as chondroitin sulfate, is often used hand in hand with glucosamine. It can be a separate supplement to glucosamine, or many of these supplements are now combining glucosamine and chondroitin into the one remedy, so that we can really get both that anti-inflammatory as well as repair, regeneration and growth of cartilage and bone process through these combined supplements. Omega-3 fatty acids are essential. They're such an incredible product, and such a diverse product that many people should be taking this. Omega-3s are your essential fatty acids, also known as your omega-3 fatty acids. They are powerful anti-inflammatories. They have a great effect on the nervous system. They also, in essence, are lubricating joints through the inflammatory process and through the lining of the joint cartilage. So it's very, very excellent remedy to be taking. In fact, you can take this in conjunction with your other remedies as well. So again, no limitation to your inclusion there. 9, this is such a simple thing for you to do. Get moving. Hope you're enjoying the slideshow and some of the great photos that we have up there. As discussed, exercise is a key component to maintaining a healthy weight. It's also an essential element to maintaining health and longevity of the condition of your body. There's an old saying that says, if you don't use it, you lose it. And this is so important. If you're not active, if you're not mobile, if you're not keeping moving, you're losing bone density at a more rapid rate. Your joints will be stiffening and tightening up at a more accelerated rate, and you want to minimize and avoid this occurrence by keeping your mobility up. Even if it's a little bit uncomfortable, it's better to move with some discomfort than not to move at all. In fact, moving starts to flush the inflammation around, starts to circulate the blood more readily, and in fact starts to improve the general health and well-being of the person. So you might think, oh, it hurts initially to move, and sure, you may have that initial soreness, but after moving for 2 or 3 days, maybe 2 or 3 weeks, the inflammation starts to ease off, the pain recedes, and you start feeling better, and all because you're more active, you're moving, and your health and quality of life are improving. Finally, of the 10 steps to prevent, manage, and enhance the health and well-being of a person with arthritis is to balance activity and rest. And as we just spoke about, you've got to be moving, you've got to be active. If you don't use it, you lose it. But at the same time, you also don't want to be overly busy, overly crazy. Many people with high demand, hectic lifestyle are actually accelerating the degenerative process in their life because they're stressed, producing the acids and inflammation associated with cortisol, and they're not active and they're not managing the counterbalance of that. So you need to maintain and stay active, but at the same time you need to reduce the stresses and have balance within your lifestyle by creating the appropriate time and place for rest, relaxation, regeneration, and rejuvenation. So we know this. A lot of this information is common sense, but it's not common practice, and that is the key distinction. As we've gone through this webinar, you'd say, yeah, of course I know I need to lose weight. Of course I know I need to exercise and eat well and take care of myself, and there are supplements I can do. It's not a question of whether you know this would benefit you. The question is, have you been doing this? And if you haven't, why not? It really is an important question to ask. Are you carving out time for your own healing? And if the answer is no, it is time to do this now. Pay attention to the pain. Your pain is the body's way of telling you that there is something wrong. The pain is the body's way of saying this is not the right place for you to be in terms of health and well-being. So please, don't ignore your pain. Don't just take a pain-killing medication or push through the pain and ignore it so that you can go about your daily activities. That is the pathway, sooner or later, to creating further damage, for creating further deterioration and leading to arthritis, or if you have arthritis, accelerating the wear and tear from the arthritic condition. Your pain is a messenger. Hear its message and take action today. So I want to conclude by saying thank you very much for your time. I appreciate the opportunity to serve you in this way and share this information with you. There is so much that can be done to prevent and manage and reduce the pain and limitation of arthritis. If any of these tips or strategies seemed overwhelming, change one thing at a time, then make it a habit, then move on to another. Equally, there's going to be more training that will come as part of your involvement with this website, your involvement with me, and we want to share more information with you so you can know what is possible for you. In the very least, continue with this training, and obviously there is the Arthritis Solution book that is available through this website, through Amazon.com. There is also additional training, the wonderful program that I've created where I can take people through the healing and transformational process by the Done For You Arthritis Solution program. Please have a look at that and take an opportunity to view our entire website and gain the resources of this so that you can recapture your health today. grateful to have been part of this, and hopefully we've been able to share some powerful information with you that I know will change your life when you take action upon it today. I wish you every success on your health journey. I wish you all the best with your health and quality of life. This is Dr. Marcus Chakos, chiropractor and founder of the Natural Treatment of Arthritis Institute, and I wish you well.